Good afternoon to all of you on the East Coast, and good morning to you if you are on the West Coast. My name is Dr. Jose Leon, Clinical Quality Manager at the National Center for Health and Public Housing, a project of North American Management. I want to welcome and thank you for attending today's webinar, Identifying Healthcare Needs with Data. This webinar is being recorded, and the resources, slides, and other materials will be emailed to you after the webinar has finished. At the end of the webinar, there will be a question and answer session. As a reminder, please complete the post survey at the end of the webinar. Your responses will help us improve our webinars. The objectives for these webinars are, after attending the webinar, participants will be able to identify various data sources on the federal, state, and local level that will assist with identifying healthcare needs, generate maps to show how medically underserved areas and populations, and understand how data can assist with HRSA service area competitions. Why is healthcare data important? Data, for the most part, consists of information in numerical form that represents a certain characteristic. I would like to introduce the speakers for this webinar. The first speaker is Joy Agonteman. Joy is the health researcher and policy analyst for North American Management. She earned her master's in public health at Washington University in St. Louis. As a public health researcher, she has covered topics such as health literacy, tailored health communications, health information technology, health disparities, and school health and wellness. Then we will have Rachel Logan, and she is the new training and technical assistant manager at North American Management. Her role involves providing technical health and management information to help health center programs meet the requirements set forth by HRSA through webinars, training manuals, personal one-on-one assistance, and symposiums. Rachel completed her Master's of Public Health degree with a concentration in epidemiology at George Mason University. I am turning this presentation over to Joy. Good afternoon, Joy.
Good afternoon, Jose. Thank you for that introduction. So as Jose mentioned, we use healthcare data. Healthcare data is very important to us. One of the purposes of healthcare data is to manage and drive improvements in healthcare. Healthcare data also helps us to get an overall perspective of the health and well-being of our population and help us understand where our resources should go. What can you do with healthcare data? There's probably a long list of things that we could do, but for those of us on the call today, the three most important things are to identify health disparities, whether it's within race and ethnic groups, whether it's by gender or income or educational background. We can also use healthcare data to show us where medically underserved populations are located and how best to allocate funding to improve the health of those populations. And then also, healthcare data helps us to measure the success of programs, goals, and objectives. So if you, for example, have a program to prevent or reduce diabetes, your healthcare data tells you where you started, maybe the number of people who had diabetes at the beginning of the program, and then maybe those who are better able to manage their diabetes as the program continued, or maybe show a drop in diabetes within your population. So healthcare data has multiple uses. For those who are in the program planning, again, healthcare data helps us to create our objectives, SMART objectives, specific, measurable, attainable, relevant, and timely objectives. Healthcare data helps us to identify where we want to go with our program and what are the key things that we should focus on with our healthcare program. So we're going now to talk about data sources, and we'll talk about federal data sources, online data sources, and local data sources. In terms of federal data sources, we're mainly talking about data sources that are run and managed by government organizations such as the Housing and Urban Development, HUD, or by the CDC, Centers for Disease Control and Prevention, or by HRSA, Health Resources and Services Administration. These federal data sources help us begin the process of capturing and describing the need. What is the problem within our population? What are associated contributing factors to the problem? And then also understand what factors impact access to primary health care, healthcare use, and health status. Most of these data sources, as we'll talk about later, are available online, so we can download it and extract and analyze the information that is most relevant to our population or to the program which we are working with. HRSA, the Health Resources and Services Administration, has what is called the Uniform Data System. This system is a core set of information that helps us to review the operation and performance of health centers. All health centers that receive funding from HRSA submit information based on the number of patients they see, the gender and race of these patients, what services were provided to these patients, diagnosis, the health care costs of seeing these patients, staffing, and clinical indicators. So this is good if you work with a health center or you're interested in working in a health center. This is a good resource to use just to, again, capture a big picture or an idea of the status of health center populations. UDS Mapper is another great resource. Rachel will go more in depth about the importance and use of UDS Mapper. But for those who may be considering applying for grants, many grants require that you show a map of the service area and so UDS Mapper is a great resource to create that map. It focuses on health center programs. This particular map focuses on health center program grantees and HCP lookalikes and where they're located in the United States. In terms of local data sources, when we say local, we're looking at state data, county data, city data, or the individual population that is served by a particular health center or healthcare provider. You can get local data from hospital discharge or from even national data sets such as the CDC, which allow you to look up information for a particular state or county or city. The importance of the local data is that, again, it helps us to narrow down the problem, narrow in on our population, and see where the unmet needs, how common is the problem, where are the gaps in service. Do we live in an area where we have really great primary care but maybe not really great primary oral care, or are we missing mental health services? And let's say we do have all those services, primary care, oral care, and mental health care, but perhaps we're not seeing people using these services. Local data sources can help us better understand what are the barriers to care. Is it transportation? Is it a lack of awareness? Is it maybe stigma associated with these care? So it's very important that whether you're analyzing or assessing a program, applying for a grant, or just trying to improve the quality of care with the health center, that you use both federal and local data sources to get a complete, comprehensive picture. Electronic health records are another great source. Most health centers and healthcare providers have transitioned to using electronic health records. And for those that may not know, EHRs, as they're oftentimes called, are just a digital version of patient's paper chart. And so from the EHR, you can extract information such as common diagnosis, medications, maybe immunization records also, and tests performed at a particular health center or at a physician's office. I also mentioned earlier that with many of the federal data sources, such as that with either HRSA or the CDC or HUD or even the U.S. Census Bureau, you can go online and be able to extract the information quickly. So you have the option of either downloading the data sets, or many of them give you the opportunity to input some information and get charts, tables, graphs, see national trends, or create maps of service areas. In addition to the federal resources, some other great resources are county health rankings, community commons, the Health Information National Trend Survey, also known as HINT, and the Behavioral Risk Factor Surveillance System, also known as BREFIS. All those services allow you to get data and facts really quick about a particular city or state. I mentioned community commons, and this is another resource similar to UDS Mapper that allows you to map out whether it's a health issue or a healthcare related topic. So for example, this particular map shows mobile health clinics within the U.S. With Community Commons, you can either create a map or you can share maps also, so look at maps that other people have created. And there's some really great tools that allow you to explore different areas and learn more about factors that are affecting your community, the health of your community. And so now we're going to take a break from the presentation and I want to show you about another resource called HUD User. So for those of you who work either in a public housing primary care program or you're interested in working with public housing populations, HUD User is a great resource that allows you to capture information related to public housing residents. So you go to HUDuser.org, and when you arrive on the page, you'll see in the top data sets, and when you click on your right-hand side, you'll see pictures of subsidized households. You'll click there. And as you can see, you can get data all the way going back to 1996. For our example, we're going to focus on 2012 data. So you click picture of a subsidized household. You select your year, and we'll do 2012 since that's the most recent available. And again, as we talked about earlier, when you're gathering data, whether it's for a grant or to assess your program, you want to be able to get a complete comprehensive picture. Get a national look if possible and be able to compare your city, your county, or your state to the national picture. So that's what we'll do here. We'll start first with the U.S. And so we want to select a program, which is public housing, and we want to look at all the variables. So as you can see, HUD User provides us with information such as the number of public housing units available, how many of those units are occupied, and then it also gives us a peek into the demographics of the household, such as the income, how many are living in low income and extremely low income, whether it's a 2-adult household or a 1-adult household, whether a female is the head of the household, an age divider, whether they're older adults or under 62, and even if they're living, and how many are living with disability. So we can then go back where you click Query Options, and we can now narrow this down furthermore. So let's say we want to look at a particular public housing agency. And we may want to be, if you live in San Diego, you'll type in San Diego. You'll see the House San Diego Housing Commission. Select, and we'll say All again. And so now you have the information for San Diego, and you can compare this to your national data if you like, just to, again, get a better, complete and comprehensive picture. HUD User also allows you to download the data to Excel so you can have it on file, on record for your own personal use. I will now turn the presentation over to Rachel Logan, who will talk about service area competition grants.
Thank you, Joy. So one of the main funding sources that health centers have is applying for the service area competition grant through HRSA, and we're really trying to ensure that you have the tools that you need to demonstrate your particular population, the need in that population through the use of data. The grant requires a few components for the application, and the most important components we'll focus on today are the service area map and table that you would get from UDS Mapper, community characteristics that you'll generate from different data sources that Joy spoke about earlier, so your community commons, your HUD user, all of those, maybe some local data that you get from your state, or also demonstrating the healthcare need, as I spoke of earlier, in your particular area, what is the actual need? Are people, do they have access to healthcare and all those different aspects that come into it? Also, here you see that we also developed a service area competition technical assistance manual that features some of the new changes to the SAC grant. And so you really want to probably check that out in case you haven't applied for a SAC grant in a little while, just to make sure that you know all the new things that are going on. So UDS is one of the main sources that health centers should use to begin compiling data and information for their grant application. UDS compiles all different kinds of data from individual health center data, quartile rankings, a lot of good information that they can use to compare with their peers, how other health centers in their state are doing, in their region, in their area. UDS Mapper is also another excellent tool, and I'll demonstrate later how to use that to really highlight some of the features of, excuse me, of the software. And Joy demonstrated HUD User, and also we'll use county health rankings. This is a picture of UDS, and so you see here I'll be demonstrating an example from St. Paul, Minnesota, and these are the different health centers in that area, and here's also another snapshot of some of these quality measures that UDS collects. And it's good to kind of compare where you've come from and where you are now. So here you see that they did trend data, and there has been a decrease in childhood immunizations and cervical cancer screening. So in your application, you may want to indicate that there's a need for this in your community. There's less screening or what have you. But you see here that their quartile ranking has also changed for cervical cancer screening, so they are improving. So the fourth quartile ranking demonstrates that there is still a need for maybe screening for adolescent weight, adult weight screenings and follow-up. Some tobacco cessation counseling is also still needed. So including some of these quality measures that you're currently engaging in and highlighting those as some of the healthcare needs of your particular population is also really good. And then maybe comparing yourself to some of your competitors, some of your neighbors, or just your general state. UDS Mapper, you use this to generate that map that is required in the application. And here's just a brief demonstration of some of the components that you'll need to include, making sure that you box the area of your particular proposed site, indicating different sites with points and labels, just some of the different things, making sure that it's a shaded area that you see here with this gray shade, just clicking on it and making sure it's added to your data table, and just understanding what this map is really showing you. So you see here the different shades of green indicate the penetration of low-income populations by these health centers in these areas. So there are several health centers in this particular area of Minneapolis, and not all of them are reaching these additional areas. So if you're located right here and you are penetrating that population, that low-income population is, presenting in your healthcare clinic, you're getting the patient base that you need from that low-income population, that's great. But if you want to expand services to another underserved population, you have to show the need. And so maybe venturing out to some of these areas that have less penetration may be a focal point for you in this SAC competition. So if you click on that service area, that zip code tabulation area, it'll add to your data table. And so we see here some of the data that's generated from that query is the percent of health center penetration of that low-income population. So most of the areas have about a 30% penetration, but then these particular two areas have a very low percent penetration, so that may be an area that you would like to expand to, highlighting that and indicating the reasons why is really good to add to your application. To compile some community characteristics, you'll need to venture out to some other sources like HUD User that Joy just demonstrated, and using that information to paint the exact picture of your particular community, your specific public housing population. And you're able to do that on a very small scale level by zip code even, or on a larger scale by the public housing authority, or maybe even your county, but highlighting specific areas and pockets through this use of data is excellent. So you see here in this particular area of St. Paul, where I matched up the zip codes from my previous search, about 86% of this population are considered extremely low income, and you also have an issue with people with disability, about 30%, a large minority population, that's the majority actually, 72%, and about 54% of people are in poverty. So including these different things in your application is absolutely necessary to show the need. And then proposing some of the things that you plan to do, some of the programs that you may already have in place that can now be expanded to this particular area by highlighting on some of the challenges this population is facing. Another excellent tool is county health rankings. So I searched for the county that St. Paul is a part of, and it's Ramsey County in Minnesota, and I looked at some of the different areas that they're facing or challenges that they're facing in their area. One easy way to do that, of course you can just read through all the data that is generated, but they have this little button for you to click on that says areas to explore. Once you click on, this orange will translate into your actual table and highlight the different areas that have extremely high or above average benchmarks. So here you see in the United States about 14% of children live in poverty, but in Ramsey County it's about 26%. Also with the children in single parent homes, 20% in the nation, but 35% in this particular county, as well as a very high and inflated violent crime rate. So highlighting these different things, maybe presenting the fact that because we have a violent crime rate, this population may need additional mental health services, they may need group counseling, more behavioral health interventions, different things like that, and using the data to really drive the need is an excellent opportunity. And then just as a reminder, I know some people are more familiar with data use than others, but making sure that you know the definition of some of your variables. So here I looked and saw sexually transmitted infections, and I was just like, wow, that's a huge and inflated number. And I wanted to know how they compiled this data, but their definition of sexually transmitted infections are really just chlamydia infections, because chlamydia is the most prevalent STI in the U.S. So they use that as the marker to measure this particular issue. So just being mindful of that. So in your application, you want to make sure that you don't generalize it past the parameters of the variable. Also, you can generate a community health needs assessment. This is an excellent tool that compiles a lot of data that can be used for various aspects of your application, but also just in general presentation and use of your particular special pop. And you go to communitycommons.org and you just type in your location, and they'll develop this packet for you that includes some demographic information, clinical care measures. Here I just highlighted the hemoglobin A1C, for diabetic patients, as well as some health behaviors that they featured here. And so you see here that they have information about the United States, then they take it to Florida on the state level, and then they get very specific with Alachua County. So they give you a wealth of information in just one quick visit to the site. And I will go ahead and demonstrate how to use UDS Mapper very briefly. So go to udsmapper.org. Just go ahead and either sign in or register for an account. It's free. And so, as I said earlier, just in this hypothetical example I'm using, I looked at St. Paul, Minnesota, and so I already know the location of the ZICTA that I want to work with and that I would like to expand services to. You may have to do a little bit more exploration of your particular area just by looking at the need or even just knowing your community well enough. I'll go ahead and type in the zip code tabulation area. And it'll search for me and appear right here, so I'll click on that, and we'll click Go. And we're going to go directly to the area. So there it is. I'm going to click on this box, and it'll actually appear right here to my right-hand side in the selected ZICTA area. And this means it'll be added to my data table that I'll need to include in my application. I actually want to expand services to both of these areas, so I'll click on this as well. You see here that the 12.4% came back up, the 9.9% penetration of this low-income population came up, as well as all of the other health centers in the area that do serve this community. So you get that information as well, but we want to know exactly where they're located. So we'll go to the right-hand side under healthcare facilities, and we'll just click to allow these other healthcare providers and facilities to appear on my map. The most important thing is not just to highlight all the other healthcare facilities, but to really highlight your own proposed site. So in order to do that, we need to label it as well as outline it. So for my points, I'm going to build my health center or expand services to this particular area. I'll label it. So you just type in proposed site or then expanded services here or whatever, and then just hit enter, and it'll appear. Let's just erase this extra point. And then we'll outline the particular service area that I'm looking to expand services to. And so you can just do a general outline for your application. I'm trying to be very quick, but yet kind of thorough, so you have to excuse me. But you can take more time to outline it in great detail. Oh, goodness. And so we're going to put a box around it. So we have that. But we also want to label where other health centers are located. But in order to do that, I just need to zoom out just a little bit. And you see the map fill up a little bit more, and you get those other health sites or health facility sites in the area. So you see here, People Serving People is actually through Hennepin County. Over here you have another site, and this is Westside Community Health Services through the Washington Technology Magnet School, so a school-based site. Here you have Open Cities Health Center. So what we're going to do is just label where some of these places are. So we know Westside is over here. So you click once again, and you just type in Westside, and it appears. And you'll have to just do that for the rest of them, the rest of the healthcare providers in your area as well. Moving on, we'll go to our data table that we generated with our specific area of interest, and we'll just look briefly to see what some of this information and data is telling us. We know that for our low-income population, we have about 22% in this particular ZICTA, 12% here. We also have a fairly even amount of minority population, so Hispanic, Black, Asian, very low population of American Indian, and these are just very important things. But the most important variable here that you see is the health center penetration of this low-income population, and that really has to be highlighted in your grant application. To move along and save all of this, you need to make sure that you go to print. When the print window comes up, you want to click data table as well, because both aspects have to be included in your application. Leave it as a portrait. Go ahead and type in the title, and you want to PDF it. So once you click PDF, a new window will come up and you can save it to your computer. If you're not able to finish everything at that particular time, you can always come back. Now it actually saves where your last place was. And if for some reason you need to start over, you can just reset, hit yes, and you're taken back to this U.S. map to begin your search again. And so this is just a brief way to show how data can be used for various occasions for every aspect of what you do at your health center. A lot of times health centers are just so busy and caught up in the different day-to-day activities that they're not able to really capture everything that they're doing. And there are simpler ways to begin to capture that data. So realizing that your EHR is an excellent tool to begin to include certain things. So if you do your mental health screening, is it in your EHR? When it's in your EHR, are you compiling data and looking at it so you can use it for monitoring and surveillance? You know, that's exactly what it's for. And if you have patients in a medical home, then you're wanting your patient to improve over time, and so that's another excellent way. When you compile that information of what your health center is able to achieve, then you can start doing presentations on it. Maybe it can now become an evaluated model. Maybe you can develop more programs from what you see in your data, or you can partner with someone else and then begin to do program planning and evaluation. If you get to that stage, then you're setting yourself up for additional funding opportunities. So a lot of times health centers are funded through HRSA, but they also have other funding streams that can support some of these enabling services that health centers really are now adopting, these social services that are becoming a prevalent part of the medical home model that we see today. And abstracts and publications, you know, are you disseminating your findings? If you're seeing patients present with certain issues and conditions and you're treating them and finding effective strategies for this particular special pop, are you highlighting that through abstract submissions? Are you presenting at conferences? So getting to the place where these simple data sources can really accentuate what you already do, as well as present more opportunities for you to do more and get the funding and support that you really need. So one easy way to compile some information is just through writing a quick synopsis of what you found. So through some of the examples that we used today that I had of St. Paul, even if you're doing your SAC grants and you're showing the need, that is excellent, but that can also be used in different arenas. So maybe a quick snapshot on your website of the types of patients you see and different statistics or information that you found to help educate maybe your funders, maybe just the public in general in your area, to bring awareness to some of the issues that this population is facing. So this example just shows you the city of Viola in Virginia, just a hypothetical city that we made up, but highlighting some of the things that this population is facing. So the percent of people living below the federal poverty line, you know, you can collect data like that, either from the census or even from UDS, premature death rate, as well as, you know, that being twice as much as the Virginia rate, but 3 times as much as the national benchmark, really bringing awareness to this issue, as well as a high-risk area. So indicating these things through the use of data. What are the stats? What are the figures and the facts related to these different health conditions, these different social issues that are affecting your population? Here you see that we also mentioned the adult obesity rate is 38%, which is extremely high, and the number of primary care physicians in the area. So getting this data to really show the need, because if you want to service this area, why do you want to service this area? What are the issues? Why should someone care about the issues here? And data allows you to do that. It enables you and gives you the tools you need to really bring to light some of these challenges special pops face.
Thank you, Rachel. So we hope today that you were able to learn about some new tools, maybe become re-familiar with tools that you've used in the past. As we said before, healthcare data could be a very useful tool, help us to capture information about a population, help us understand where money and different resources should go to help us develop programs, and how to best serve our populations and improve healthcare. Healthcare data can help us whether we're planning a program, actually implementing a program, or evaluating our program. We here at North American Management and this National Center for Health and Public Housing have various resources and tools. In addition to the webinars, we have a few monographs, we have fact sheets that you can use, training manuals, newsletters, including our weekly digest, our annual symposium, which is taking place next year, June 10th through the 12th, here in the Washington, D.C. metro area. And then we also offer one-on-one consultations. So if you ever have any questions about healthcare data resources, how to analyze the data, what to do once you analyze the data, or you need assistance with your grant, please do not hesitate to contact us. These are a few additional resources for those of you who are applying for grants, whether they are federal grants or grants put out by private organizations.
Oh, I want to interject for just 1 second. So going back to the technical assistance that we provide, the research department is an excellent avenue to link yourself to different data sources that you may not be aware of. So we do have health centers or individuals contact us with data requests saying, you know, I want to go after this funding source, or I need data specific to this, you know, obesity in my area, and I'm not sure where to get that information from. We do specific data requests. So at any time that you feel that you're not able to complete or obtain the data that you need, please feel free to contact us to ask us to assist with that in particular.
Thank you, Rachel. We will now take time for questions that you may have.
Thank you, Rachel and Joy, for this wonderful presentation. We are going to start the Q&A session. If you have any questions, please submit it through the questions box on your control panel, or use the hand raise icon and your line will be unmuted. And we have one question. Can you explain other ways I can use my EHR aside from UDS reporting?
Yes. So in addition to UDS reporting, you may be able to use your EHR data to develop programs. So for example, you can do an assessment, maybe the number of people diagnosed with obesity or high blood pressure. And you may want to, if you, for example, an individual practitioner, maybe on your own office, decide that based on that number you want to start offering additional resources, maybe some pamphlets, some brochures, or referring your patients who may be at risk for those conditions to health and wellness programs that can also assist them. If you're a health center, you can do the same thing. Use it to identify additional resources that can help you to better serve your patients.
Thank you, Joy, for your response. There is another question. What other training about data presentation do you have that I can share with my staff?
That is a good question. So some of the training and technical assistance we provide are presentations such as this. We can also speak offline to someone if they have specific questions. So I feel like someone should contact us directly for some of those specific issues. But just in general, we have webinars online as well as some training tools, technical assistance tools on our website that health centers can look at.
Thank you, Rachel. We have one more question. Are all the data sources you presented today free?
Yes.
Yes, the federal, for example, the federal data sources, if you were to go to either the CDC website or the HRSA website or even the U.S. Census Bureau, you'd be able to access the data for free and also download the data for free.
Yeah. Now, for some specific issues, if someone was interested in program planning, they might need a specific request form to just outline what they want to do with very specific data. So I know the CDC may have some public data available, but you may need a request form for very specific information about individuals or such if you were more into clinical research or medical research.
Thank you, Rachel and Joy. There is another question in the queue. Is the service area competition grant relevant to FQHC satellite applications for a health center in public housing?
Yes. So the service area competition grant is really for health centers who are now proposing to expand services to another area, and that's for any grantee. There are specific requirements for health centers, so I would suggest going to either HRSA's website because they have information, as well as when the announcement comes out, thoroughly reading that. But health centers are able, even PHPC grantees are able to get that funding.
Thank you very much, Rachel and Joy. And there is one more question. Are there any other statistics tools you use to collect or compile data?
We use a lot of different tools and different programs to collect our data. Some are as basic as Excel. We also have Stata here in our office. We use just a range of data sources, so all the federal sources that are available. So, it could be DOJ, it could be USDA, just depending on the variables that you're looking for. Administration on Aging, if you're working with aging populations in public housing. ACL has other surveys. The CDC is an excellent tool for all the different surveys that they have on various health issues, so you can find general information. For health centers, they may want to contact their health department because I know a lot of health departments do monitor different priorities and diseases and different things, as well as their state and just the state and the local health department. So you have to kind of expand your horizons and really be open to using different sources and then trying to see how that will fit into your particular population. So how specific does that data get, as well as some free mapping software. So I know a lot of people are now into mapping everything, so that's what we recommend, using Community Commons. I know some people have some raw data that they collected and they want to just plug it into a system and let it generate the map. So I know some people use Google Earth. I've used it a couple of times. I've also used another mapping software that was free. I think it was BatchGeo. So there are just different softwares and things that you can use. Maybe Joy has some other sources.
No, actually, you mentioned most of the ones that I've used also in addition to the ones listed within it. So again, community health rankings or county health rankings, Community Commons. I think for me personally, the most sites that I use are CDC because CDC has about 8 different survey and surveillance systems that they use, collecting everything from birth and death statistics to behavioral factors to insurance rates, variables related to healthcare access. That's one of the most popular ones that I use. And then as Rachel mentioned, it can range to other branches of the government, so the USDA, DOE, and the U.S. Census Bureau. A lot of people don't realize it, but the U.S. Census Bureau helps to collect a lot of health data and just population data that's relevant. For example, how many people have smoke detectors that are working? What are potential hazards for seniors living, such as things that could cause them to fall?
Thank you, Rachel and Joy. I do not see more questions in the queue. I want to thank you one more time for this great presentation. And to all of our attendees, please complete the post survey. This helps the National Center for Health in Public Housing to improve our webinars. And if you have any training or technical assistance needs, please contact any of our talented staff members. Once again, thank you very much for attending this webinar, and thank you to Joy and Rachel for this great presentation.
Thank you.
Thank you.